We all are chasing dreams. Dreaming big is in our DNA. Our spirit is designed to defy and define new boundaries every second. But often, our dreams face disruption by our very own DNA. One such disruption is diabetes. According to Burden, the pioneer in diabetes care and research, 6 million people in Bangladesh are diabetic. No matter how old we are, when our body cannot naturally control the amount of glucose due to insufficient or no production of insulin by the pancreas, we are identified as being diabetic. Although a bit of discipline can help control glucose among the type 2 diabetic, but each beat of a type 1 diabetic depends on an effective insulin. The days are not far when insulin was not affordable by all and was not available everywhere. We noticed this, and now with our best insulin like Dr. Ibrahim, we are happy to hold the hands of million diabetic dreams. Over almost a decade from our state-of-the-art facility, we have delivered 36 million vials and 9 million cartridges to keep you in good health. Incepta's world-class biotech facility, built as per EU GMP and WHO guidelines, assures quality standard of insulin and insulin analog formulations. Thus, our Endeavor Maxsulin is absolutely effective and safe. This is where it all begins. Only after being approved by our up-to-date quality control measures, the world-class insulin API crystals and other excipient reach the dispensing station. Highly sensitive scales are used here to dispense materials as per our robust formulation. The dispensed materials are compounded in specially designed vessels following approved manufacturing instructions. Prior to this mixing, the vessels are cleaned with highly pure water for injection using dedicated programmable CIP and SIP automation system. The solution obtained are then filtered and stored in specially designed vessels for the reactions to take place as per approved manufacturing procedure. The holding of insulin solution at the right temperature for the right length of time is crucial to achieve the desired quality. The insulin vials, when ready for filling, is fed into the Bosch Trouble machine. Bosch Trouble allows automatic washing, depyrogenation, filling, stoppering, and sealing of the vials and cartridges. This prevents contamination of insulin during filling and sealing. The vials and the cartridges have different filling procedures. Thus, they follow a different filling route enabled by our combo filling line. The sterile vials flow to the solution filling station and are sealed under all aseptic conditions to make sure no harmful particles are present in your insulin. On the other hand, the sterile cartridges undergo siliconization. This makes sure that you get the correct dosage while using it with our pen set. The cartridges are filled with the insulin suspension from a vibro mixer. This special machine ensures the uniform filling of suspension into the cartridges. Both the sealed cartridges and vials are now ready for inspection and labeling. But before they're labeled, the finished products are tested at our modern state-of-the-art quality control laboratory for confirming the physical, chemical, and microbiological specifications. During production, the in-process samples are also tested here. During different stages of analysis, sophisticated analytical instruments like high-performance liquid chromatography (TOC) analyzer, atomic absorption spectrophotometer, UV visible spectrophotometer, auto titrator, Karl Fischer titrator, etc. are used. With the reliable combination of machines, material, manpower, and method, we make sure that uniform quality standard is attained in every unit used by the patients. Our dedicated microbiology laboratory comprehensively tests biotech products to avoid microbiological contamination. Microbiological testing ensures several parameters like sterility, presence of endotoxins, liquid-borne particle count, etc. With the reliable results from dependable machines and confirmation from keen professionals, we make sure what reaches you always works in the expected manner. After receiving approvals from all inspections, they are finally labeled and packed. We have electronically controlled cold rooms in the manufacturing and quarantine areas to ensure unbroken cold chain management. From the warehouse carried by cold vans, Maxsulin reaches your nearest drugstore.
We have created country's first research, quality control and production facility dedicated for biotech products only. This is why the market share of Maxsulin injection is increasing consistently with bigger focus of other biotherapeutic cells trajectory.
What more we have done to make the best is the design of our facility. This design ensures unidirectional man and material flow. The differently graded rooms are separated by air pressure differentials. This prevents mixing of air of one chamber with the other and thus restricts unexpected particle flow. The workers are always in special gowns and masks to meet specific operation. This restricts contamination caused by human. This is the place from where critical factors like airflow, particle count, humidity, temperature and other industrial conditions crucial for safe manufacturing are monitored and controlled online. They too look after the required maintenance at all stages of production. We believe and follow a world-class validation approach. This approach enables us to produce insulin of global standard in our well-equipped state-of-the-art facility.
Thank you, Maxsulin.
Thank you, Maxsulin.
Thank you, Maxsulin.
Our biotech team, specialized in handling large and complex protein biotherapeutics, is looking forward to establish Incepta as a research-based company in global manner.
Manufacturing a large molecule like insulin is undoubtedly a great challenge. No matter what we face, our priority of keeping patients safe and healthy always stays on the top.